Welcome to today's episode. Today we're going to be talking about the war with Iran and the Republicans' plan to cut healthcare spending in order to fund this war with Iran. I apologize if the lighting is kind of weird. I'm trying out a new lighting technique, but I really am tight on time, so I'm trying to make this episode really quickly, so it might look a little weird, but I'm going to fix the lighting next time. Anyways, there are Republican leaders in the House of Representatives that are looking for ways to fund this war that we are in against Iran. One of the genius ideas they came up with is to make cuts or reforms to our healthcare system and use that money to fund our war spending. The Pentagon has asked for approximately $200 billion to help fund our military operations in the Middle East. This money has to come from somewhere, and there are no great options on the table. Their options are basically to either raise taxes, increase our financial deficits, or do this thing called budget reconciliation that's going to allow them to take money from somewhere else in order to fund this war. Budget reconciliation is a shortcut that allows the government to pass a spending bill with a simple majority. A simple majority means that rather than needing 60 votes, they only need 51 votes from the Senate in order to pass this legislation. Now, here is what they want to change in healthcare. Number one is they want to change the subsidies that are given under the Affordable Care Act, which you may know as Obamacare. Subsidies are federal funded discounts that lower the monthly cost of your insurance, and they are based on your income. Now, this would actually save the government a considerable amount of money, but it could also result in hundreds of thousands of Americans losing their health insurance. Number two is they want Medicare to pay the same price for services whether or not you go to a hospital or a smaller clinic. This sounds reasonable, but you need to keep in mind that hospitals have more expenses in order to stay afloat and keep on running. If these hospitals are being paid less, they may have to cut certain services in order to keep those expenses lower. This would affect smaller or more rural hospitals more because they already have less healthcare options to begin with. Now, the smaller clinics won't really be affected by this because the hospitals are the ones being paid more for the same service. So if the payments between hospitals and clinics are equalized, the clinics will keep the same revenue that they already had beforehand. Number three is they want to stop insurance companies from overbilling the government. This would also save money for the government, but it will also change the benefits that people are getting from their Medicare programs. Medicare coverage, but same thing. Number four is they want to enforce stricter rules for Medicaid. An example of these stricter rules could be employment requirements. The result of this would be that fewer people would qualify for Medicaid coverage. Now, this would actually reduce the amount of money that is spent on healthcare from the government, but this could also result in people paying more out-of-pocket expenses for their healthcare, or more people will end up losing healthcare all overall. My friends are here for a split second. I just got given some brownies from Abigail. Yep. What would you like to say to the pod?
Your body is a temple, so take care of your health and it'll take you a long way.
Get your 10,000 steps in, exercise.
10,000 steps. Don't drink alcohol.
Don't drink alcohol, or at least drink it in moderation.
Wait, can you give them a review of the brownie?
Okay, well, no, you gotta try one with me then, and we can review it. We're gonna try Abby's brownies.
Hold on, you gotta do... Okay, 2 out of 10.
Yeah, they're not that good. They taste kind of like they were made in an easy bake oven.
Give me my
brownies are really good.
Yeah,
good?
The brownies are pretty good. They're very hot, but they're very good. Thank you guys for watching. Podcast is over. Sorry for the interruption. Back to what I was saying. The plan being proposed by the Republicans would actually result in less healthcare spending from the government, but many Americans will end up paying more money out of pocket or completely losing their healthcare coverage. And the money that is saved by reducing our funding towards healthcare will be used to fund the Iran war. That is not cheap at all. I'm sure everyone has heard about the fact that the first week of our conflict with Iran cost over $11 billion. And this $200 billion request is meant to keep our military operations going on for months. So now we're faced with a dilemma. What is more important to the federal government? Domestic care for Americans or national security funding? This question is actually not as simple to ask as you would think it is. Some of you guys might think it's a no-brainer, but the answer to this question varies based on the context and which politician you were asking. But I want to talk more about the effects of this potential healthcare cut. Most of us are aware that there were big changes made to Medicaid because of Trump's Big Beautiful Bill. The Big Beautiful Bill imposed work requirements and restricted eligibility for Medicaid benefits and Medicaid coverage. Analysts have estimated that because of the Big Beautiful Bill, there will be a result of 10 million more uninsured Americans by 2034. Medicaid serves low-income people, pregnant women, elderly people, and disabled people. This means that cuts to Medicaid disproportionately affects the lower-income people and the vulnerable populations of America. But these potential cuts to healthcare that we may see in the future will also affect the middle class, because those who buy their healthcare through Obamacare are at risk. Because of how the healthcare system works, insurance companies raise their prices on certain plans to make up for missing government payments. So when the government doesn't fully cover certain costs, these higher prices cover the difference. This sounds sounds bad, but it is good. This results in a lot of people, especially middle class people, getting bigger subsidies because subsidies are based on how expensive insurance is. This results in their monthly insurance plans being really cheap or sometimes free. The Republicans want the government to handle these expenses directly because that will stop the insurance companies from adjusting these prices and raising these prices in order to cover the differences. This means that insurance prices will go down because companies will no longer have these adjusted rates. But since subsidies are based on how expensive insurance is, the amount of subsidies that people receive will also go down as the price goes down. So people who had lower insurance rates because they were receiving such good of subsidies will not be receiving such good of subsidies anymore because the price of insurance is going to go down. If you're not following, this means that they will have to pay more for insurance. So that means that even though insurance prices are going down, they will still have to pay more for their insurance. Some experts, I don't know what experts, estimate that around 300,000 Americans will end up uninsured because of this. This is confusing and deceitful because even though the prices are cheaper, people are going to have to pay more out of pocket. So basically, the Republican lawmakers want to get rid of subsidies for health insurance and use that money instead to fund our war against Iran. This will also reduce the amount of help that people get regarding deductibles and copays, so it means that it's going to be more expensive to actually use your healthcare. I'm just going to give a quick summary of what this means for you. The financial support that lowers your monthly insurance costs will be or can be reduced if this bill gets passed. So you may end up paying more money every month for insurance. At the same time, your deductible is going to go up, so that means you're going to have to spend more money up front before health insurance actually starts to kick in and start covering expenses. Because of this, some people are just going to opt out of insurance because they're not going to be able to afford it. Those of you that live in states that have expanded Medicaid, such as Michigan, California, New York, Ohio, and Pennsylvania, will be affected more by these healthcare cuts because you guys, or we, because I live in one of these states, we rely more on Medicaid in these states. But keep in mind, none of this is official. This is what Republicans are trying to pass. Now let's talk about if they could actually do this. This is not as simple as just passing a bill because there are a lot of political and legal obstacles that are going to slow down this potential bill from being passed. You should know that in the Senate, most laws need at least 60 votes to pass because of something called the filibuster. There are only 53 Republicans in the Senate, not 60, and it's very unlikely that Democrats are going to vote on a bill that's going to cut healthcare spending in order to fund a war. This is why Republicans are looking at something called budget reconciliation, which we talked about earlier. Reconciliation allows them to pass this bill with only 51 votes. But there is something called the Byrd Rule that says that anything in a budget reconciliation bill must directly affect spending or taxes. Anything that's more about policy rather than money can be stripped out of the bill. This is relevant because all the changes that the Republicans want may not get approved, and some parts of their plan is already being questioned. But if the budget reconciliation approach doesn't work, they still have one other option. That option will be to call war funding an emergency. If Congress labels this as an emergency, then they can fund this war without cutting funding to anything else. And this is how a lot of war funding has been acquired in the past. Now, from the outside looking in, this sounds like the best idea. You may be wondering, why don't the Republicans just do that? Let's just declare this an emergency, then we don't have to cut healthcare spending, but we can also fund this war. They don't want to do that because this is a midterm year and this is going to look really bad politically if they were to do this. They don't want to look like they're just adding to the national debt for no good reason. So to protect their image and their odds of winning in the midterms, they would rather cut spending somewhere else and use that money to fund the war, because then we cannot say that they are adding to the country's debt. Even if the bill makes it through the political filters, there are still legal obstacles that they will have to face. Hospitals could sue the government if they lose funding, or insurance companies could sue the government if these new rules cut into the profitability of these insurance companies. I've been researching this all day and I can say that this is a very complicated process, but it is possible that this does happen. But realistically, it looks like a lot of the parts of this bill would be removed and the legal obstacles will slow this process down considerably. So this will not be a smooth and quick process, and there will not be healthcare cuts this month or next month. And the final version of this bill that does end up getting passed, if it does end up getting passed, will look very different than this little rough draft that we have of it right now. But they may not even win the simple majority vote in the Senate because the Republicans know that there's going to be some political consequences to this. It's a midterm election this year, and the Republicans know that they will get a lot of backlash and lose a lot of votes if voters are saying that they lost their healthcare coverage because of what the Republicans have done. And the Democrats will not hesitate to weaponize this rhetoric of saying that the Republicans are paying for a war against Iran by taking away from the health of Americans. So there's a lot of tension surrounding this potential healthcare cut. And keep in mind that all the information in this video is as of March 31st, 2026. This is changing really rapidly. The war is changing. This bill may be changing over the next few weeks. So if you are watching this later in the future, just keep in mind that some of this information could have changed by now, or it could be a little outdated really quickly. New information may come out too that was not considered in this podcast because I did not have that information at the time. But thank you for watching this episode. I'm glad you made it all the way to the end, and subscribe to stay informed. Thank you very much. See you.